And now I'm gonna get us on our Facebook.
Okay. Good.
We're all set.
Hi, everyone. And I just want to say welcome to MHI's Healing Circle. Tonight we have our healing circle is going to be talking about a lifestyle. The doctor that's going to be with us tonight is going to be talking about lifestyle medicine and how we can do. Her name is Dr. Coeurlida Lewis Ashby. She is a board certified lifestyle medicine internist who obtained her medical degree from Yale University School of Medicine. Dr. Ashby completed her internal medicine residency training at Yale New Haven Hospital, where she also served as chief resident of the Yale Primary Care Program. She moved to Florida in 2009 for the weather. You know, it's cold up there where she was. So she moved down to get some of our sunshine. After more than 17 years in the medical experience, Dr. Ashby transitioned from medical practice to lifestyle medicine to focus on prevention and disease reversal. She is one of only 3,000 board certified lifestyle medicine physicians worldwide who focus on reversing chronic diseases using lifestyle. Dr. Ashby walks the talk herself as a professional bodybuilder and nutrition and wellness expert. Dr. Ashby's lifestyle medicine practice is located in Sarasota, Florida, and online at lifestylemedicalsarasota.com. And she is accepting new patients. So I introduce to some and present to others. Dr. Ashby, you could take over. Thank you.
Thank you so much, Helen. I appreciate that great introduction. Thankfully, now there are even more than 3,000 lifestyle medicine physicians worldwide and in this country. So I'm very proud to be sharing a little bit of that field with everyone. Today, we're going to focus on heart health, given that this is Heart Health Month in our country. And it's a very big topic because it's the #1 killer of Americans, heart disease and heart disease related things. So I have slides to talk to you about for 20 minutes and we'll take questions and I'll begin now. So as you mentioned, I've been in medicine a while and lifestyle medicine is still practicing medicine, but the approach is with nutrition and other things that we do every day, like movement, quality of sleep, and other habits that can help give us health or take it away. So when I do these talks, I always say they're educational, it's for information sharing, it's for our upliftment. But if there is a medical question that is personal, it's always important to speak to your own physician, especially when this is being live streamed or questions might come up about your own personal situation. So it is not a substitute for professional medical care. Please still consult your physician. So knowing your risk is what the topic is today, because a lot of the first-time heart disease patients didn't know they were having heart disease. And I'm going to share with you a few key things to keep in mind when thinking about heart disease and whether you're one of the ones affected or your family member is affected by this condition. I share this true story because it was very impactful. I was helping at a hospital a few years ago, and about this time of year, just end of January, when the New Year's resolutions is bright and shiny, someone made the plan to start jogging. Unbeknownst to them, they had coronary heart disease. They'd never had any pain. They went out for a jog and fell. That was their first heart attack. Now, after EMR brought them to the hospital, unfortunately, the damage was so much that by the end of their 7-day hospital course where I took care of them, they were already getting organs harvested. So all this to say that during the time where people might be excited to get new habits and start the year fresh and think about their health again, a lot of times it's important to know the signs on the inside before we do the stress test of going out and jogging or going out and getting on a fitness program without knowing what the status is inside the arteries. It's not to scare you, just to raise awareness that going out and jogging getting that gym membership, getting more active. If it's sudden and a change for you, it may be a stress test. And if you don't know about your risk, it's important to know that when you take up new habits like that, especially at the beginning of the new year. So let's talk about, how do you know your current risk of stroke or heart attack? There's an actual percent number that can be calculated that can give you some clue about the percent risk of a heart attack or a stroke. These are the same processes. One heart attack happens in the heart with the arteries of the heart getting clogged, and the other one happens in the brain attack or a stroke, and the arteries in the brain getting clogged. So a little bit more about this. I mentioned the heart attack that happens here. There's plaque and there's a clot. And when there's a lot of demand on the heart from a jog, this blood flow here that is reduced is the reason of the heart attack during the jog. So I'm going to show you how to calculate your risk after I give you a little bit about the state of heart disease now in our country. And then we'll talk about some risk factors other than cholesterol. I think everyone knows about the contribution of cholesterol. And now more people are starting to understand that maybe it's not all about cholesterol. Maybe there are some other risk factors. So I'll check on those. And then we'll talk about the first steps to do if you end up having a risk. So heart disease, as I mentioned, #1 killer of Americans. As much as COVID destroyed a lot of our society and caused a lot of havoc in the last couple of years, it still was the #3 cause of death in 2021 compared to cancers, all cancers combined. But then heart disease still killed more people than those two other leading causes. So it's important to note that this is very prevalent and that a lot of people are affected by it. We see again, back in 2020, heart disease was still the #1 cause of death throughout the time of COVID. And we know a lot of people died from COVID, 300,000. Well, more than double that died of heart disease that same year. So what's the burden? Every 40 seconds. So by the time I finish this presentation, many cases around the country will have been newly diagnosed as having had a heart attack. Burden of cardiovascular disease, every 40 seconds, someone has a heart attack or a stroke. A few other facts besides that 20 seconds. About 1/5 of all heart attacks are silent, and this especially happens in women, which is important to know about the other signs other than just the chest pain. And even though every 40 seconds someone has a heart attack, the number of people that have the condition of cardiovascular disease, that plaque that lines the artery, is 18 million. You know, we know about the diabetic epidemic that's happening now in a country where we're having 5-6 million diabetics in the country. Well, heart disease is 18 million. Okay. How much of that is preventable? Can you believe that of all of these cases and every 40 seconds having a heart attack, that many of those cases are actually preventable, and up to 80% according to some sources, preventable cases of heart disease and of stroke. The #1 leading cause of death. And men and women, both affected, but more men. One, you know, if you have 3 men, 2 of them already have heart disease. That's the statistic in America. And in the female category, of the 3 that might have it, 1 of them will die of stroke or heart attack each year. So the burden of disease really does not seem to discriminate. I did mention that 80% of this was preventable. So we're going to talk about what we can do about the preventable components. First, to do something about the prevention, you have to know your risk. So we're going to do a little bit of an exercise here with these statistics that are very scary, right? Gives us a headache and a heartache. But I'm going to tell you that at your fingertips on your phone, if you go to Google, you can search ASCVD. That stands for atherosclerotic cardiovascular disease. You just put that in and you get a list of calculators. The American Heart Association and the American College of Cardiology both have calculators that you plug in some numbers and they spit out a % risk of having a heart attack or a stroke in 10 years. it's important to do that exercise and maybe do it alongside your doctor or ask about this so you can know your risk. Again, this is very preventable, so we should know where we stand on this. When you get the calculator, it will ask you for your age, your sex, your race, because different races have different degrees of risk. It will need your total cholesterol, which you should know. Maybe also look in that a little bit more carefully for the healthy cholesterol, also called the HDL. It will need your systolic blood pressure, that's the top number, and the diastolic blood pressure, which is the bottom number. If you treat it for blood pressure, then you'll put yes here. If there is diabetes, then you'll put yes here. And if there is smoking, you'll put yes here and then hit calculate. This will spit out an actual percentage. That is the percent risk of having a heart attack or a stroke in the next 10 years. It's any moment between now and 10 years. This is how we as physicians and cardiologists have a little bit of information about your risk based on your age, your gender, your labs, your blood pressure, and your risk factors. So once you plug in these numbers, there will be some information for you on the side, right from Google, and that says whether you have a percent risk that's high, low, or medium. So low risk is anything less than 5%. Let's say you have a 0% or 1% risk of having a heart attack or a stroke in the next 10 years. That's good. We'll take that. 2%, okay. 5%, that's considered still good. But as the risk of having a heart attack or a stroke in the next 10 years goes from 5 to 7.5%, that's considered to be a moderate risk. Why is that? Well, imagine in 10 years, your risk of having a stroke is 5 to 7.5%. In any one of those years, you could be at risk, right? So that's high enough to do something about it. And right now in our conventional society, we have options. There are statins that are often offered. There are possibilities of even reversing the disease with lifestyle. So, but something should be done. So here you'll see the recommendations are to consider a statin, but look at what led to this risk factor and address it as well. That's where lifestyle medicine comes in and looks at the root cause, the actual reason for this condition, and address that. A lot of times it's dietary, so that's a big opportunity. If the risk is between 7.5 to 20%, that's a moderate risk. Statins also recommended. And I see a lot of people with high risk who don't even realize they have a high risk of having a stroke or a heart attack anytime between when this is tested and 10 years from now. So it's a really good and easy exercise for you and your family members to be aware of, to speak to your doctors about, to know your risk is the beginning of doing something about it. Okay. So obviously you can't do anything about your age, your gender, or your race, but what can you do to change the risk if it happens to be high? Well, the cholesterol is part of that equation. The good cholesterol is part of that equation. The blood pressure is part of that equation, right? Both the top and the bottom number. Is the blood pressure controlled? Is it treated? Is there diabetes or is there not? Is there smoking? So all of these that are circled here are opportunity areas that people can address to help lower the overall cardiovascular risk. They seem simple. Each one may be simple, but when you add all of them up, that's why a little bit of each one can lead to a big risk. So those are the opportunity areas: the total cholesterol, the healthy cholesterol, the blood pressure control, metabolic health, meaning diabetes. So it's important to note that while we have a long history of blaming cholesterol for heart attacks and strokes, and now it is becoming clearer that it is not the only bad player or the only component to heart disease, right? It's just one of the factors. 50%, and in some places, the data is even more compelling that the cholesterol may not be the primary factor in some of these heart attacks and strokes. So while it's important to note if it's high and to take care of it, know that there are other risk factors that are worth looking at as well, in addition to the cholesterol. You know, that person who has their heart attack and their cholesterol was fine on their last physical, I'm sure is very surprised or shocked because their cholesterol levels were normal. Well, this is part of the story. It's not just the cholesterol that leads to heart disease, okay, in half the cases. So think about the blood pressure, think about diabetes, think about smoking, which affects the lining or the health of the arteries, the actual lining of the arteries, okay? So if we take cholesterol out of the picture, let's say that component is fixed, we're still left with multiple other items and more. These are the only two that I mentioned here, but there are other factors that contribute to heart disease. So point here is don't rely just on the cholesterol, although if it is not where it should be addressed. As I mentioned, sometimes in certain data sets, you will see that more than 50% of heart disease is unrelated to cholesterol. This is a slide that exemplifies that. You know, a lot more than 50% of people may have heart attacks with normal cholesterol. So again, just driving home the point, it's not just about cholesterol. Let's see some of these other factors. Of course, genetics, inflammation, which is something we can do something about, kidney disease, something called insulin resistance, which is not tested on a regular basis in our population, but is very, very important to know. The amount of visceral fat that a person has, that's fat that's inside the organs, not just the one that's under the skin, but fat in the abdominal section, in the liver, in the viscera, okay? There are ways to know about these markers, but they're examples of the other factors that contribute to heart disease or cardiovascular disease, not just heart, but also vessels in the brain that have nothing to do with cholesterol levels. So if you're in the United States and you have high blood pressure, the highest risk of dying from heart attack comes from having an uncontrolled blood pressure. So this quote here is, in the United States, hypertension accounts for more cardiovascular disease deaths than any of the other modifiable risk factors. So high blood pressure is the danger sign for dying from your heart disease. So I suggest it be the one that is focused on if it is out of control and you don't even know whether it is heart disease, right? Because the heart disease, you won't have any pain until you're having a heart attack. And even then, for many women, they're not realizing that they're having their heart attack. If the blood pressure is uncontrolled, that's your sign that cardiovascular disease is out of control. If you do have high blood pressure, you should own a blood pressure machine, right? You should be checking it and you should know what the variations are, and you should discuss the values with your doctor and see if there can be improved control. Let's talk about some of the numbers that you might see and maybe what you might want to see, right? We've always known that less than 120/80 should be good in general. If it's anything above 120/80, that should be flagged. And of course, greater than 130/80 or 90 is also high risk. This one risk factor, if it is addressed, even when the person may have an event with the cardiovascular disease, the risk of death from the heart attack is impacted, can be improved. How do we then get the blood pressure under control? Let's talk about that, since it is one of the deadliest risk factors, high blood pressure. Well, we've always heard about avoiding salt. It's very simple. You know, salt does help to retain water in the wrong areas within the vasculature, which if you have a vasculature that's stiff because it's lined, imagine you have pipes that are the vasculature and they're lined with plaque, which some of them might be calcified. So the vasculature is then stiff. It has very little give. And so when that happens, it is important to know if you increase more fluid in that pipe, it increases the pressure in the pipe because the pipe can't relax, can't accommodate because it's stiff. So you see how a stroke might happen or an event might occur in the cardiovasculature. So things to avoid, things to replace the salt with: lemon, ginger, turmeric, and other spices. Added salt isn't the place that Americans are getting that salt anymore. It's mostly from processed foods. And the saltiest foods: bread. And I don't know if anyone would have guessed this. Of course, cold cuts, cured meats, pizzas, certain canned soups, but for bread to be up there, it is one that most people do not even think about. Potato chips is not even in the top 5. So if bread is part of your diet and you have a salt problem, you're getting salt every day. So think about that. So that's the hiding place of salt in our current society. Bread beats out chips as the biggest salt source. That's from the CDC. One slice has over almost 200 milligrams of salt in it. And how much should you have a day? Well, if there's high blood pressure, 1,500 would be great total milligrams a day. And if you're having, 200 milligrams in a slice of bread, a few slices, and then whatever else you're eating, you're way over this 1,500 milligrams. Most Americans are getting about 3,500 milligrams of salt a day. And with that amount, the blood pressure is staying higher. There's so many salt substitutes now. It's so easy to fix this issue, but it does take time. It does take careful attention to what we're putting into our bodies. The regular chicken noodle soup here, 890, so 900, almost 40% of the total salt that we need, just 1 cup of soup. But if you choose the low sodium, which some people might not, the taste buds can recognize when you've switched to low sodium. Sometimes it takes some getting used to. It's a much better option if salt is the issue for you. Again, it's hidden in packaged foods and in breads, if you had to take 2 takeaways from this. So there are substitutes. Instead of getting 40% of your salt, getting 20% of it from green salt, Mrs. Dash, and other alternatives. Something that is a salt alternative will have potassium chloride instead of sodium chloride. And that's a key point there, because potassium actually helps our blood vessels. Okay. Potassium is a positively charged electrolyte, if you will, and so is sodium, and they play with each other in the body. When you take more potassium, okay, your body gets rid of more sodium. Okay, so it does help to ease the tension in the blood vessel wall, and that helps to lower blood pressure. We used to have recommendations for low salt. Now there's even recommendations for aiming to have more potassium in the diet. Now, this is from foods, not just potassium supplementation. Very important point here, because obviously too much of anything can be a problem, and that's the case with potassium. However, if it's from your food sources and you're keeping track with an app like MyFitnessPal, you can aim to track your potassium and see how much you're getting. Instead of that 3,500 of sodium, make sure it's 3,500 of potassium that you're getting a day. And these are some foods that are better with potassium. Something people don't think about: potatoes, broccoli. But if you say potassium, a lot of times some will guess that tomato is up there, but broccoli is higher, and potato is even higher in terms of potassium content, which is helpful. So potatoes, tomatoes, some fish. Decide on your meal plan. That's probably the best way to go about addressing this. Whole grains, fruits, vegetables. There's so many meal plans out there, but you have to have a focus. Let's say the blood pressure is the focus, and improving the blood pressure is the focus. Then you look for a meal plan that is for blood pressure, and that meal plan will likely have the foods that are higher in potassium, a little bit better choice, and reduce salt. One of the names of diets, and I don't like to necessarily prescribe diets, but they're easy to think about and remember. But the DASH diet. The DASH way of eating is one keyword that you can put in a browser and look for meal plans that are DASH friendly, that will be specifically helpful for blood pressure. Okay, so magnesium is important, potassium is important, omega-3s are important, vitamin C and calcium. A lot of times when we have illnesses, the deficiencies in nutrition at the same time that's happening. And so some of these common deficiencies are there during the cardiovascular diseases. And if they're repleted, that helps the nutritional status. Okay, so I know it's been a lot of information so far. We talked about the risk factors for heart disease, traditionally being thought of as cholesterol, but it's not just about that. We have other contributors to heart disease. And of the others, blood pressure is the one that is the killer of the modifiable risk factors. And to think about it in terms of the number of people who are affected in both men and women, it's staggering. So, you know, there might be people in the room or people watching who have loved ones who are affected by this. It's worth taking a closer look into by calculating the risk, addressing it with your doctor, coming up with a plan to address one of the risk factors that can be fixed, because it affects a lot of people. 1 in 3 women die each year of a stroke or heart attack, and every 40 seconds, someone is actually having an event. So, number one killer, a lot of it is preventable. You can calculate your risk. Don't just say my cholesterol is fine, I don't have cardiovascular disease, because some people are surprised, and it's not a nice surprise to have. It's easy to check your blood pressure with a machine from the local pharmacy. Find out if you have the silent killer risk factor, blood pressure. And February is Heart Health Month, isn't it? So I wish you know your risk as the first step in your journey to help make sure that your cardiovascular disease is the best that it can be. So there's many resources online and you know, with healthcare providers on heart disease. I just want to bring your attention to this book, The End of Heart Disease by Dr. Joel Fuhrman. There are many others. And this is because heart disease isn't a sentence that once you have it, it is actually not reversible. It used to be taboo to say the word reversible with heart disease. It is not anymore. There are people, other doctors, other providers like myself, whose sole practice centers around reversing and controlling the condition using lifestyle, because a lot of this is a dietary and lifestyle issue. And so there's hope. And if you do have a condition and you need to speak to your doctor and you need lifestyle help, help is out there. So I'll stop sharing so I can take questions. And that's all I have for you today.
Thank you so much for your presentation, Dr. Ashby. It was very informative. So when people say a silent heart attack, what does that mean exactly?
Well, it means that the person experiencing it didn't even know they were having a heart attack. They might not even have been aware. Maybe there was a fatigue, weakness, maybe some sweats. Some women who are going through menopause often are the ones who have these, quote, silent heart attacks, because they take their heart attack symptom for menopause symptoms. You know, they're weak. And so because of the weakness, and maybe it's a bit unusual, they get seen and they get a EKG. And in the EKG, there's been a heart attack. So they don't even realize when it was. So that's one thing. Other people just have shortness of breath, which brings them to get evaluated. And the cardiovascular evaluation may include blood work that shows that they actually had a heart attack. And but the person didn't know it. So the silent heart attack is true and happens a lot in women because the signs are not as classic. And there's not the big pain in the chest and pressure that a lot of other people feel. And but it is a confirmed heart attack by EKG or the blood work.
Any more questions? Were there any questions on Facebook, Onyx? Did you see?
There aren't, but I do have a question. I was wondering, like, in terms of like the biological, like what's happening, what's the connection between diabetes and these cardiovascular issues?
Wow, good question. Diabetes, I think, is probably the most widespread risk factor for the acceleration of cardiovascular disease in our country, because it itself is an epidemic, and then it's pushing cardiovascular disease forward. Why does diabetes do that? Because in the diabetic state, there are microvascular or smaller vessels everywhere in the body are getting damaged. So while the classic heart attack of someone who just has a big clot or cholesterol plaque in one artery, they get one closed artery and it's clean. In someone who has diabetes driving their cardiovascular disease, what you see is all the arteries are caked up with inflammation, damage, and then plaque. So it's the ability of diabetes to affect every single major organ, and that puts it in the mix of heart disease. And when it is in the mix of heart disease, it's often not one vessel that has one clean plaque or blockage or clot. It's all vessels that are just sludged, damaged, and lined with plaque. So it makes the disease more diffuse, almost more difficult to address, because let's say some classic case could get a stent placed in one artery. A diabetic won't have that possibility if they have multiple vessels that are affected at multiple areas. One stent won't fix the problem. So diabetes makes the disease very diffuse, we call it. It's an inflammatory condition. It's generalized, and it causes small vessel disease everywhere. That's why the eyes are affected, the small nerves in the toes, the penis for men, erectile dysfunction. With this metabolic epidemic, erectile dysfunction is now common among 30-year-olds. It's because of microvascular disease, small vessel disease, the retina, the penis, the nerves, the kidneys. Those all have small vessels, as well as the brain. So that's why stroke is a risk factor there. And when it happens in the heart, it's diffuse heart disease. It's a very important risk factor to take hold of.
Thank you.
Let me check the chat, see if there's any more. No, is that it? No one else? Any more questions? No?
I have another one if no one else does.
Okay. All right, go ahead. Dr. Ashby, thank you so much for that information. I took a whole lot of notes because I do have high blood pressure. So, and I'm luckily have started some of this change. My gallbladder helped me change some of the weight I'm eating. So I can't eat certain things that I used to eat when I've lost weight. So that's been a blessing right there. So I did take notes. So thank you again for the information and the stuff that you shared with us. And before we close, is there anything that MHI is doing, Onyx, that we need to let people know before we sign off?
I think she had one more question.
Oh, did you? Okay, I'm sorry. Go ahead.
Yeah, and I also see Miss Angie came off. Miss Angie, did you want to add something?
No, I just appreciate her,
Okay.
the information that she gave. I could relate to a lot of it dealing with my daughter, just passed away last year with complications due to diabetes, congestive heart failure. I could relate a lot to what you were saying, and training yourself to eat the right way. It can be challenging because we get comfortable eating the wrong things. But then when you actually see, when it hit home, when you see a family member go through the things that my daughter went through and others dealing with diabetes,
Mm.
it really makes you want to get on the right track.
Yeah.
So I appreciate this very much.
Mhm.
Absolutely. And, you know, my heart goes out to you. That's really a devastating thing to go through, especially with a child. You know, diabetes, I was in Boston and the news was on, and it very casually, the segment was that it is now the fastest growing chronic condition among 20-year-olds. Just
Wow.
like that on the news. And so it's a rapidly growing problem in our society, and it is a lot of that also is reversible and preventable.
Right.
And it's a great opportunity, but it has to do with lifestyle. And it's difficult to change habits, but it is doable. But you need community support, accountability. People can't do it usually in a vacuum on their own. And I find that those who succeed in my circles are usually very well supported within their families and have knowledge, you know, some information, as well as support to help them through. It's becoming more and more available.
Yeah, I was just talking with my granddaughter. She has 3 daughters. And I try to instill in them and encourage them so much to please go get tested, get your blood work done, because I'm sure it's in the bloodstream at some point, with their mom going through so much when she was here, you know. And but these young people, it's like beating your head up against the wall. They don't take anything serious, I guess.
Well, especially when there are no symptoms initially, or they're very minimal. The symptoms are minimal until something goes wrong. You know, it's easy to ignore it. And that's not, you know, when you're young, you're not thinking about disease and health issues. So that's why the environment that they're growing up in, the exposures that they're seeing, the unconscious habits that are forming and within the family units dictates what the health is going to be like 20 years later. So it's what they're exposed to. And this we see this in school kids, where, you know, COVID forced a lot of kids to maybe just get the food that's available at school. And in some cases, unfortunately, some kids, and my daughter was one of those, she was like, Mom, I gained some pounds during this time and I don't want to have the school lunch anymore. And so it's something that is very slow, because the bad changes happen without big warnings. It's just a small habit here, a small taste change there, things that she didn't like to eat before that she started eating, because they were just available, and they were just available. So that's something we have to think about for the young ones, you know, instead of forcing them to focus on the disease, is really what environment are we providing for them to grow up in, what is available to them automatically. It's the automatic things that get done. We have to make it easy for the good choices to be what happens in daily life, because they're busy being kids. They don't want to stop and think about disease. Some of this diabetes that's happening to a lot of kids is just what's around them, what's easy for the parents to get. It's the fast life.
Yeah.
Yeah.
Thank you so much.
Yes, absolutely. My pleasure.
Yeah, thank you. And you basically answered my question too, which was just like, when you're working with patients on these lifestyle changes, what are some of the greatest challenges or most common? And what do you do when you navigate them? I don't know if you have anything else to add, but you addressed it pretty well just now.
That's a really good question. This is not something that can be done in an office visit, and I don't ever conduct my lifestyle transformations in an office visit one-on-one. It doesn't work. You have a few minutes with a patient and you tell them to eat better. You might even be able to give them a couple of items to go do for the week. They are motivated. They are interested. They're there for you because they want to be better. But when they get home, and then they have to get ready for work, and then they have kids, and then life is just, where is the time? It doesn't happen. So I don't leave it to the willpower of my clients or patients to execute on things like that. What I do ask them to do is to gift themselves a time. If they can gift themselves 1 hour a week, then they're in a coaching group with a few other people who are working on the same purpose, and they're meeting once a week. They're discussing challenges, progress. We're checking off items that have been done or haven't been done. We're learning, and then we meet again the next week. And that continues week after week after week for a minimum of 4 weeks. That's how transformation happens. It's hard to expect someone to go out and in the environment that's automatic for them to suddenly be transformed. Some people can do it. Some people can, because maybe the pain might be too much, or the cost might be too much, or they're up against a wall, they've got to do something. But if it's not at that point yet, most people, life takes over. So the success stories that I do have in transforming lifestyles happen because habits are being changed over time, little by little, with reinforcement, accountability, support, good information, so that you can see success right away. And then when you let off the hook and you're by yourself, you realize the distance between what you're actually doing and what you were doing when you were in the group. So you can see how close you are to really doing it right. You can check for yourself. So I think any behavior change program is going to look like one where the practice is happening in an experiential environment, right? It's kind of like, if you want to be a star athlete, you don't get, you don't get told by the coach, okay, this is what I need to do, and then go for the week, execute it. I'll see you next month. It's the same thing. You asking someone to change the way that they operate, and without any structure, it's a losing battle. It's a losing battle, and it's difficult for us to ask that of patients and then expect them. We have to expect them to come and say, well, I was able to do this and that, and when they fail, they're feeling guilty, put the blame on them, and then they feel like nothing's working because they're not set up for success. So for behavior change, it's got to be in a coaching environment, 100%.
Okay.
Thank you.
Any more questions? I see Dr. Merritt that you've joined us. Is there anything you want to say about the heart, or any response you need before we close out?
Oh, well, I just want to thank Dr. Ashby for her wisdom, her articulate grace, and she's helped us with a few people, and we just are so proud of her and the other young doctors that have come to town, and members of the Gulf Coast Medical Society. That Multicultural Health Institute is very happy to partner so we can expand the awareness and the necessary education in culturally representative and sensitive ways that everyone can relate to. I want to also say that you're absolutely right, Dr. Ashby, and that's why we started our diabetes support groups that Angie and Darlene and Bonnie have been so wonderful in going through and getting certified in the T2 training. And we had a really transformative experience just even last night at the library group that Darlene was doing. It's both a hybrid and in person. And a couple people just sort of came in, not even knowing, but hearing about it. And it ended up being a real positive experience. And it was a good memory for me because I used to do a monthly support group at the library every month for almost 13 years. And you build relationship over time and you encourage one another. And it's that bond and that community that helps to reinforce the desire. And, we always start with like, why is it you want to do it? What's the reason? What's the, what's the desire? How do you want to be? How do you want to feel like? So you can keep that front of people. It's not like, well, the doctor said I should do this, or the test was bad and I need to do that. You know, it's got to be because people want it. And I share with the group that it's a hard phase for me because I lost yet another family member on the anniversary of a previous family member that I had lost. And, you know, it's this week it's celebrating 3 Black men in their 50s who all died too young. And so we have to just try what we can and do this work and love one another and not be judgmental, but really be encouraging and finding the strengths and not focusing on the setbacks. You know, it's a 2-step forward, 1-step back experience at times. So I do thank everybody for attending and those who will view it later. And you can find information also on our website about diabetes. Do the pre-diabetes assessment. There's a lot of people don't realize that they're on the way to diabetes. If you take some of those questions seriously and look at them, it will help you to maybe motivate the kind of changes that Dr. Ashby is speaking of. So just thank you very much, everyone. And, just awesome team. And thank you, Onyx and Helen, for, helping to coordinate everything and make sure it all runs well. It's just important work that we're trying to do at MHI. So we appreciate you.
I appreciate you. Thank you. Absolutely. Love the community support groups. Those are key for longevity. Yeah.
All right. So if that's it, and there's no more questions, and thank you, Onyx. If there's anything that MHI needs to let us know that's happening, or
like Dr. Maris said, the diabetes prevention groups. We have 2 weekly sessions, so check it out. And we also have a monthly tobacco cessation support group. So 2 of the risk factors Dr. Ashby was addressing. So check that out on our Facebook or on our website. It's all up there. And then the last thing, we're also doing a lot of environmental advocacy right now, and we will have a 2-day workshop on the 24th and the 25th, exploring those issues. We got some great speakers lined up. We have interactive as well as a film screening, so it'll be dope. And yeah, that's all I got. Thank you so much,
right.
Dr. Ashby. That was fantastic.
Yes, it was.
Absolutely.
Thank you. Yeah.
Absolutely.
All right.
Know
Well,
your
thank
risk.
you. Yep. Thank you so much. That's it.
All right. Take care, everyone.